Good morning. My name is Nathan Hochman. I'm the Los Angeles County District Attorney. I will be joined here on this podium by Sheriff Robert Luna, LAPD Chief of Detectives and Deputy Chief Alan Hamilton. And with me from the District Attorney's Office are the prosecutors who've been prosecuting fentanyl traffickers and fentanyl poisoners. We are joined by Deputy District Attorneys Benjamin Schwartz, Catherine Mariano, Seth Carmack, Mackenzie Temori, Mark Inaba, Celeste Sanchez, and Shireen Nizami. Today, what we're going to be talking about at this press conference is something that could not be more serious. We're going to be talking about a silent assassin in our community. This silent assassin will kill more 18 to 40-year-olds than anything else out there. This silent assassin is fentanyl. Fentanyl is a synthetic opioid. It is 50 times stronger than heroin, 100 times stronger than morphine. It basically will kill you in 2 minutes. 2 milligrams will kill you in 2 minutes. 2 milligrams, by the way, is the size of 1 grain of rice. I have in this bowl probably about 500 grains of rice. This little bowl right here could kill 500 people. This bag of rice could kill basically 2,500 people. And we have been seizing kilograms of fentanyl. We seized recently, earlier this year, 50 pounds of fentanyl. And to give you an idea of how much 50 pounds represents of illegal doses, that's over 11 million illegal doses. Lethal illegal doses of fentanyl. That's enough to kill every man, woman, and child in LA County. We have seen that fentanyl is an indiscriminate killer. It doesn't care about race, it doesn't care about ethnicity, it doesn't care about religion, it doesn't care about sexual orientation or gender. It is an absolute silent assassin that is killing at least 8 people in this county every single day. It kills more unhoused people than anything else out there. It is the type, and I give you an analogy. If we looked at a silent assassin as someone who would be a sniper on the 405 freeway, and their aim was unerring, it was absolute. Every single day they would kill 8 people with a sniper rifle coming off the 405 freeway. I would venture to say we would stop a whole lot of stuff we were doing until we found that one sniper. Now imagine there are hundreds of snipers up and down our freeway system in LA County. I would tell you that LA County would shut. We would probably shut still until law enforcement could round up every one of those snipers killing people in our community. And that is exactly what the silent assassin fentanyl is doing. And to show you its exponential growth, in 2017, or before 2017, the number of fentanyl-related deaths in our county was 0. It was an East Coast problem that eventually came West Coast. And why is it coming West Coast, and why is it the number one killer of 18 to 40-year-olds? Because it's incredibly addictive if it doesn't kill you. The Mexican cartels are lacing it in all different types of drugs. They're lacing it in these counterfeit pills. Adderall, Xanax, Percocet, Oxycontin. It's been laced into marijuana, cocaine, ecstasy, heroin. It is basically, again, a killer that, and to give you an idea of my introduction to this several years ago, was I met a couple, Sam Chapman and Dr. Laura Berman, who had lost their 16-year-old son, Sammy, to fentanyl poisoning. What had happened is he had gone on Snapchat. He was a 16-year-old kid, good kid, at a local high school. And he goes on Snapchat and he wants to experiment. And he goes ahead and he reaches a drug dealer on Snapchat, gets the drug dealer to deliver him counterfeit pills. Now, he didn't know they were counterfeit, and he certainly didn't know there was fentanyl in them. But by the time his brother woke him up that next morning, he was dead. I applaud the efforts of people like Sam Chapman and Dr. Laura Berman, who've tried to turn that tragedy into a wake-up call for America by trying to get Sammy's Law passed by Congress They would go ahead and require online platforms like Snapchat and TikTok to allow parents to put monitoring software into their kids' basically phones so that they could detect whether or not those kids have interactions that could kill them, that create opportunities to deal with drug dealers or firearms or cyberbullying. We'll see if Sammy's Law finally gets passed by Congress in this session. So I want to highlight for you some of the range of cases that we've been involved with. I highlighted fentanyl poisoning as one of my 6 priority areas. We have formed with our sheriff partners, with our LAPD partners, fentanyl task forces to go after the various ways that fentanyl is killing people. And we've also increased the educational efforts to make sure that the kids and their parents understand that fentanyl is not about getting high. Fentanyl is about killing you. The DEA estimates that 7 out of 10 of the millions of counterfeit pills that are coming across our border into this county carry a lethal dose of fentanyl. To give you a perspective on that, if you go ahead and play Russian roulette with a 6-shooter and you put the bullet in one of the chambers and you spin it and you put the gun up to your head, that's a 1 in 6 opportunity. Fentanyl is 7 out of 10 it's going to kill you. It's got worse odds than Russian roulette. So when I emphasize that this is basically a crisis issue for this county, I am understating the fact of what this drug, what this silent assassin can do. So let me give you a couple examples of the cases that our fentanyl task force has been involved with that are making a real difference out there. We recently convicted David Pierce, 43 years old, from Hollywood, who a jury convicted on February 5th of this year of 2 counts of first-degree murder in the fentanyl overdose deaths of Christy Giles and Hilda Marcela Cabreles Arzola in Beverly Hills back in November of 2021. Their photographs are right here. Pierce was also convicted of raping them and other forcible sexual assaults against 7 different women between 2007 and 2021. He's actually scheduled to be sentenced today. He faces 148 years in prison. Maybe not enough. And again, it just shows you that these 2 women had no idea that when they were being given the drugs that night, one of the drugs was fentanyl, and it ended up killing them. In another case, Justice James, 23 of Winnetka, has pleaded no contest to 6 felony counts of child abuse related to the fentanyl overdose of her 3-year-old twin sons, Josiah and Justine, and she pled no contest on October 16th. She was immediately sentenced to 18 years in state prison. And back on July 11, 2024, James found her twin boys unresponsive in their home in the San Fernando Valley. The children had ingested fentanyl from her purse while she was asleep. Casey Harding Linder, 40, of Granada Hills, pleaded no contest on August 11th of this year to 1 count of involuntary manslaughter for selling fentanyl and methamphetamine to Mo Ida Solomon in 2023, who died from the overdose hours later in her downtown Los Angeles apartment. We are going to go after the fentanyl poisoners, and I use that word specifically. They are not traffickers, they are poisoners, because what they are peddling is poison, in some ways no different than cyanide. And when they go ahead and they kill someone, and they knew that this was a type of drug that could kill someone, we will go after them for manslaughter, we'll go after them for second-degree murder type of charges. And again, to the extent that anyone has been charged with a crime that I describe or any of the law enforcement officers today describe, those charges are just that. It is not evidence itself. That evidence will be presented in a court of law where we intend to prove beyond a reasonable doubt that these individuals committed the crimes with which they have been charged. I'll deal with 2 more cases. Eric Lamont Johnson, 30, of Los Angeles. He was charged with 1 felony count of possession for the sale of controlled substance and sale of transportation and offer to sell controlled substances back on September 12th of this year. During a traffic stop about a month before, on August 21st, on the 91 freeway on-ramp just east of Lakewood Boulevard, K9 alerts on his trunk and a box thrown out of his window led officers to find 7 individually wrapped and vacuum-sealed bricks of suspected narcotics, later identified to be fentanyl, later weighed to be 7.6 kilograms. Translated into lethal 2 milligram doses, that's 3.5 million lethal milligram doses that have been thrown out of the window of a car by Eric Lamont Johnson has been charged in his complaint. That's amazing. I mean, again, we had 50 pounds seized in an apartment in Downey earlier this year, enough to kill everyone in Los Angeles one time over. We had 3.5 million lethal doses thrown out of a window, to give you an idea of how much fentanyl we have going around in our society and why this press conference and making sure we get the word out is so important. And the last individual case I'll focus on is Jenny Catalina Moreno Parra, 42 years old, of Wilmington. And she was charged on May 28th with 1 felony count each of bringing an illegal substance into a jail facility. This is a juvenile jail facility, Barry J. Nydorf Youth Facility. She brought in over 30 pills that tested later for fentanyl. She was taken into custody by the Los Angeles County Probation Department Special Enforcement Operations Team, and if convicted as charged, she faces 10 years, 8 months in prison. Again, those are charges that have been brought against her, at which she will now face those charges in court. And part of the reason we're focused on this issue on this date right before Halloween is that we saw a couple years ago people use candy. These drug dealers use candy to try and transport this fentanyl. 3 Halloweens ago, on October 19, 2022, the LA Sheriff's Narcotics Bureau detectives and the DEA basically at Los Angeles International Airport seized 12,000 suspected fentanyl pills as they were trying to go through screening. It was discovered that these fentanyl pills were inside of Sweet Tarts, Skittles, and Whoppers candy boxes. And they weren't candy. These were fentanyl pills. And so we want to put out this public service announcement to all the kids and most importantly, the parents, that when their kids are going trick-or-treating, and trick-or-treating is a time-honored, wonderful tradition, and they're getting the candy, then inevitably they will. The parents have to check that candy. Well, this year, and quite candidly, every year going forward, because there is a chance, and I say this to send the warning, that fentanyl might be laced into these different types of candies, and you gotta check the candy. You just have to. Because you don't want to be in a situation where somehow, God forbid, one of your kids ended up with one of these boxes that went ahead and had fentanyl laced into it, and that the consequences will be absolutely dire. So I highly recommend that people focus on this issue. It truly is a silent assassin. And along those ways, and to hear more about it, I now would like Sheriff Robert Luna to come up to this podium.
Good morning, everybody. Obviously, a lot of information, a lot of very critical information. But if you get anything out of what we're going to talk about today, for whether it's the LA County Sheriff's Department, the LA County District Attorney's Office, or the Los Angeles Police Department, everybody standing up here has had personal testimony from a lot of parents, mothers, fathers, brothers and sisters who have lost family members, and they beg us to do something about it. So a lot of what you're hearing today is really further educating our communities that this is very, very dangerous. Fentanyl continues to be an urgent drug threat to our communities and claims way too many lives across our county and our nation. Here in Los Angeles County, our close proximity to the border has made us a major transshipment hub for illegal drugs like fentanyl. Bulk quantities of drugs are often stored in local warehouses, storage units, and stash houses, then broken down into smaller amounts for distribution, both to the local street dealers and traffickers transporting these narcotics across state lines. In 2024, the Los Angeles County Sheriff's Department seized more than 1 million fentanyl pills, along with an additional 250 pounds of fentanyl powder. So far in 2025, year to date, we have already seized well over 564,000 fentanyl pills, as well as 129 pounds of fentanyl powder. These numbers reveal how much fentanyl is flowing through our communities, unfortunately. Every pill seized represents a potential life that is saved. And we are beginning to see the impact reflected in the decline of overdose deaths so far. In 2024, Los Angeles County recorded 2,438 drug overdose deaths, marking a significant decline from the 3,137 deaths in 2023, representing a 22% reduction countywide. While the declining trend in overdose deaths across the country and in Los Angeles County is encouraging news, overdose deaths and drug poisonings remain the leading cause of deaths for Americans between the ages of 18 and 44 years old. Every number I name, though, represents a life, a family, like those I began my presentation about. Someone's child, parent, sibling, or friend. These are not distant tragedies. They are happening right here in our immediate communities, in our schools, and even in our homes. And the DA talked about some of those examples. This decline in drug-related deaths represents meaningful progress and a testament to the collaborative work of law enforcement, health agencies, and our communities working together. And that's what you see, the teamwork around us. Since we launched the Sheriff's Overdose Response Task Force to combat fentanyl, the fentanyl crisis, and the rise of drug-related deaths, since the inception, drug-related deaths have dropped approximately 30%. Several key factors have contributed to this downward trend. One, the increased availability of Narcan and the fentanyl testing kits have empowered both first responders and community members with tools they need to save lives in real time. Number two, expanded public awareness campaigns. Community awareness have helped educate our residents about the dangers of fentanyl, especially fake pills that often look identical to legitimate prescription medication, but certain deadly doses, or they contain several deadly doses of fentanyl. And third, very close collaboration for us between our federal, state, and local law enforcement agencies. We are ensuring that there is aggressive prosecution to those who traffic and distribute fentanyl, holding them fully accountable for the devastation that they cause in our community. While we've made measurable progress, new and dangerous drug threats exist. One of the most concerning is the rise of nitazines, a powerful new class of synthetic opioids originally developed decades ago as potential painkillers, but never approved for medical use because of their extreme potency and high risk of overdose. Nitazines are sold or mixed into other drugs such as fentanyl and counterfeit pills, but they are especially dangerous because Narcan is a lot less effective when people use those against it and requires multiple doses to potentially reverse its impact. We saw the deeply impact of this drug firsthand in April of 2024 in a tragic case in Santa Clarita. In that incident, it caused the death of a 22-year-old man who believed he was buying oxycodone pills while trying to cope with a mental health challenge. Earlier in the month, this individual was sentenced to 17 years in prison, marking the nation's first criminal case involving the death linked to this very dangerous drug. In September of 2024, the Sheriff's Overdose Response Task Force investigated a Lancaster case that revealed just how far dealers will go to push this deadly poison. In this investigation, a Lancaster resident was indicted on multiple narcotic and firearm charges, including the distribution of fentanyl resulting in death. This was the first known case in the nation where a drone was used to deliver narcotics, leading to a fatal overdose. This case was investigated in partnership with our federal partners and demonstrates the strength of multi-agency collaboration in combating the crisis that we're describing. While we remain focused on holding fentanyl dealers accountable and getting this deadly drug off of our streets, we must also focus on the education and prevention, particularly amongst our youth. With cell phones, apps, and social media, buying drugs has become as simple as sending a message, and that's why this makes it so dangerous. This is why we're asking parents to really pay attention to what your kids are doing on that phone and understand the lingo. Very, very important. Every life saved, every young person educated, and every dose of fentanyl taken off of our streets is a step towards safer and healthier Los Angeles County. And every dealer held accountable for distributing this deadly drug is a measure of justice for the families who have lost loved ones. And again, that's how I started this, talking about the families, because that's what it's really about. I'd now like to introduce the Chief of Detectives for the Los Angeles Police Department, Deputy Chief Ellen Hamilton.
Thank you, Sheriff Luna. So we've heard some of the statistics here, and I'm going to focus on a message to the families and the residents of the city of Los Angeles. First, though, I want to thank our partners at the District Attorney's Office, the Sheriff's Department, our numerous federal partners, and acknowledge the hard work of the Sheriff's Overdose Homicide Task Force, and then also our LAPD Narcotics Detail, along with our High-Intensity Drug Trafficking Area Task Forces and our LA Impact partners. They've been doing a phenomenal job addressing this transnational organized criminal activity. I want to send one message very clearly. These transnational organized criminals who are importing fentanyl into our communities in Los Angeles are killing our youth. As the sheriff said, it is the number one killer of our youth right now, age 18 to 44. If we don't take effective action and continue to address this, those numbers may go back in the other direction, even though we've seen a decline. Here in the city of Los Angeles, we're hoping to stay around 1,000 for total overdose deaths for 2024, and that is a decrease. But here's the thing. If we take our eye off the ball, those numbers can very easily reverse. If you look back a couple of years ago, before the East Coast xylazine impacted some of the sales that were going on with fentanyl out here on the West Coast, the numbers were going up steadily. But then when xylazine hit, you also saw a lot of a death and disability, because it becomes markedly more difficult to apply Narcan and bring people back when they've lost, motor function completely. We've seen some effective tools being used by all of our partners in the medical field and in street medicine with bringing some of those individuals back after an overdose, with the application of Narcan, with the application of oxygen in a crisis situation. But as the sheriff detailed, as these new strains of fentanyl come out and other chemicals are added to them, it requires us as law enforcement and our partners in the medical field to play catch up to find effective treatments that we can apply in the street to save lives. So it becomes more difficult, and it is a challenge. Within the city of Los Angeles, we have seen a number of different cartels, transnational organized criminals, importing large amounts of fentanyl into the city of Los Angeles, and we've been taking very effective action. I'm not going to detail the specific cases that you've seen throughout the last few years regarding some of the tragedies that we've seen in Los Angeles, as they've been detailed here by the district attorney and by the sheriff's department. But I'm going to focus specifically on a message to our communities in Los Angeles. For the parents, you need to be aware of what your children are doing, both online and in their social circles. Social media has proven to be a conduit for all of these dealers that are out here peddling drugs to your kids. There are many different methods that they use. I will tell you that the sophistication with transferring the narcotics to individuals that are victimized has become more sophisticated. They use methods such as dead drops, where they agree to a online transaction on social media with the cash or however they pay for it, and then they leave the narcotics in a specific location to be picked up by the victims. And these kids truly are victims. A lot of these kids have no idea what they're buying. A good example that I try to use when we do our Truth series throughout the city of Los Angeles, it could be something as innocuous as someone that's studying for exams that needs to make sure they get a good night's sleep, and they just want to, something that's going to help them get sleep so they can wake up, more refreshed and more ready to take on that exam. So they'll utilize narcotics, what they think are narcotics, and contained within those narcotics, those pills, quite often is that small amount of fentanyl that's going to cause tragedy. That tragedy that's caused by that small amount of fentanyl, these victims do not know that when they buy that pill and they think it's just going to be an upper or a downer, or something that's going to help them be more alert, or something that's going to help them sleep, has no quality control. There's no quality control for these pills being sold to these kids and young adults. So they think it's going to be something that's going to help them, and it's actually something that's going to kill them. If you think, I often use the analogy of a chocolate chip cookie. You don't know the positioning or the amount of the chocolate chips in the cookies. Some have more, some have less. But think about this. With no quality control and without knowing what substance are in these pills, it's very, very easy to have a high dosage, an unmixed dosage of fentanyl inside one of these pills that's being passed along to our youth and to our young adults. And that one incident is enough to kill someone. As the district attorney detailed, that 7 out of 10, those are terrible odds. Those are absolutely terrible odds. So this Halloween, the city of Los Angeles is asking that parents are aware, they remain aware of what's going on with their kids. When your kids are trick-or-treating, there should be no consuming of anything until those treats that are, that are given to your kids are fully inspected, and anything that is prepared, that is given to your children during trick-or-treating, if it's not from someone you absolutely trust, it should probably be discarded. If there are open packages of candies or anything like that, those definitely need to be discarded. No one should be giving you open packages. If something is opened and it doesn't appear to be what's depicted in the packaging, that needs to be disposed of. If you think someone has passed along narcotics to you or your children during Halloween or trick-or-treating, you need to call 911 immediately so that we can do an immediate investigation to make a determination as to the source of that material and to make a determination if it contains narcotics. I'm going to close with this. We're only going to be effective in combating the scourge of fentanyl and all of these tragic deaths if we work together as a community. As I've discussed, we've had a truth series that we've been having throughout the city of Los Angeles for years, where we talk about the threat to mostly to youth. And I want to make sure that everyone here understands these incidents are occurring in your schools, in your churches, and amongst your kids. And if you don't pay attention to it, they will cause tragedy in your family. The Los Angeles Police Department, in conjunction with the Los Angeles County Sheriff's Department and the LA County DA's office, stands ready to fight this scourge and to take effective action. Thank you.
And now we'll take any questions.
Sheriff, the synthetic opioid you mentioned, like Tozings, I know we're both struggling to pronounce it. Can you talk a little bit more about that, as far as how that's getting around, who's trafficking it? It sounds like when you said it's a drug was developed here, so that's not like a transnational thing. Just anything more you can share on how that's getting around and what to look out for.
First, in regards to it being trans, I wouldn't say it isn't, as opposed to it is. And we're kind of playing catch up with that from a medical perspective with our narcotic detectives, but we're comparing a lot of notes. Today, we're just putting out a warning that these more potent type drugs are coming out. Wherever they're coming from, we'll figure that out together. But our thing is, as a parent, as all of you as individuals and your partners in communicating this out, you got to be careful with what you're taking. I think the deputy chief described it perfect. These aren't approved by any pharmacies or federal organization that regulates them. So we just got to be very cautious.
Is there anything different about how it affects the body? Any other way you could give to end users? You know, some people use like test strips to identify fentanyl as a narcotic.
Now, the only thing I can tell you is that it appears to be even stronger than fentanyl, which is very, very dangerous.
Any other questions?
You know, I'll always go more than one.
Mr. Quealy, if you'd like another one.
No, I mean, this is unfortunately obviously no laughing matter. You have a case mentioned up there involving the death of children that ingested fentanyl. I'm sure you know, you're the one proving the cases. There have been a number of those in the Antelope Valley lately, right? Someone leaves it out recklessly, and causes the death. You know, you guys are obviously taking new approaches to charge these cases. The sheriff's department's always making the arrests, but there is another pillar to that problem. I feel like often when I'm covering these cases, you find out that the person had prior visits with DCFS, there was prior knowledge to law enforcement, and again, this is not meant to be pejorative to the sheriff's department, but awareness to your other county partners in DCFS that there had been drugs in the home before, and there had been visits and questions about whether or not custody should have been taken away. So is there any more you can talk about what you guys are doing? I know it's another county agency, but like, there's only so much you can do to stop the influx of drugs, just to deal with the, you know, the charges after someone dies. But we have these situations where kids are left with parents that are, you know, have a record of leaving drugs out, of potentially maybe not being fit parents. Is there anything more either of you can be doing to deal with, frankly, the DCFS failure that's led to these issues?
In regards to working with other agencies, I know DCFS is not represented here, but I sit on several task forces where DCFS and other county partners, such as our health department, are part of these task forces, along with community-based organizations. I got to tell you, you're asking a very, very good question. It makes me sick to my stomach when I get these notifications that we had specifically a child or infant death because somebody was careless that way. What I would ask our community to do is, if you're suspicious that either a family member or a neighbor may be either using or selling any of these type of narcotics, and you know they have other family members around, I know it's probably difficult to call the authorities, whether it's DCFS or us at the Sheriff's Department or LAPD, but you have to do it. You're literally saving somebody's life by letting us know that a child may be in danger. The more specific information, say an organization like DCFS receives, obviously they are mandated to investigate that. Sometimes they utilize us. We'll cross-reference our records to make sure that we're getting to the right folks. And at the end, the goal is to save many children. I know we've had a lot of tragedies, but I can also tell you there's been a lot of success stories when we've been called under the circumstances I just described, and we're able to deal with the narcotics, safely take that into custody, and then separate the children from whether they're parents or guardians that are obviously being very, very irresponsible.
Any other questions? And again, I want to thank everyone here today for being here for this very important press conference. I think you got a sense from the examples that we used of the types of people that we're prosecuting, whether it's people who are using fentanyl as almost a date rape drug and it ends up killing people, whether it's people, parents who are going ahead and using fentanyl and then going ahead and leaving it out, and their young children end up dying from it. Whether it's situations where people are basically fentanyl poisoners and dealers, and they're knowingly giving it to people and just hoping they don't end up dying, and they end up dying. We're prosecuting those folks for manslaughter and murder. And again, whether or not it's just the fentanyl trafficker who's dealing so much fentanyl that you can throw 7.6 kilos out the window when you're stopped and a dog finds it. We're going after these fentanyl poisoners. And so again, please take this message to heart, that the enforcement efforts in the last year, or even over the last 2 years, have significantly ramped up. So if you're a fentanyl poisoner and dealer out there, we're coming after you. And for the parents, and I'll focus really on the parents, at this time of year, you heard from Deputy Chief Hamilton, you heard from Sheriff Luna. This Halloween season, we do not want to see even one death that could possibly be linked to fentanyl. So please, please be careful with that candy that your kids are going to receive. Thank you all very much for being here.